Today is a very exciting day. This is a celebratory day of partnership working between health and education. Julie McGinty is in the lead role, and she's employed within the Public Health Agency, and we've secured joint funding from Department of Health and Department of Education to really enhance the partnerships within our special school with our community statutory bodies, and also to look at the community voluntary sector. Hearing the voice of the child being critical is part of that. So this is to showcase a lot of the work that has been happening over this last year and a half.
I was absolutely delighted that Minister Givan and Minister Nesbitt were able to show up today to show their support and renew the commitment to children with special educational needs and disabilities, and they've described how it is on the programme for government, and I think that we have raised it on the agendas of many of the organisations that are around the table.
Placing our special schools at the heart of their communities, connecting them with local statutory services, councils and the voluntary and community sector has been a key tenet to the success of this project. Voices of children and young people are key, and I understand that this project has also included a programme of activities that has tested models of engagement with children and young people. The views of children and young people should be central in all that we do, and I want to commend the participating schools for their engagement in this vital work. I can also assure you that I'll continue to work in collaboration with other ministerial colleagues to secure that additional resource that's needed to improve the outcomes for children and young people with complex needs. It's in this space that the continued success of my department's partnership with health colleagues will be critical.
So the joint vision of health and education is that special schools should become visible, should be vibrant, and should be connection hubs within our local communities. And our places, spaces and services will be equipped to include our children and young people in all aspects of daily living, because we want them, as everybody else, to have the best possible start in life. And we aim to assist them to become progressively independent and to optimise their educational, their personal and their life outcomes. And it's well recognised the best opportunity to get things right is through early years and childhood. My departmental officials work closely together, and we fully recognise this needs to start at the grassroots level, listening to you, bringing together schools, trusts, families and the wider community and the voluntary sector. And as I say, it's important to note that no one department or agency can do this in isolation, and ultimately the transition from school into adulthood will require a whole system approach.
So it was fantastic that the two ministers were both here. Great to have obviously health and education working together, and reassuring to hear from both of them that they're going to meet afterwards as well to continue this journey.
Our children cannot exist on just one service alone. And from everybody that we listen to and all the lovely, heartwarming stories that we've heard, I think what came across really, really strongly is that there is a need for something more than just education in a special school. There is a need for the therapeutic interventions to start breaking down barriers for our children, to let them access and let them fulfil their potential. And they have huge potential, they really do. So the voices of the children is something that I think people nearly overlook when a child has got special needs. And there is a way to capture their voice in different arenas, through different therapeutic interventions. But one of the big things is getting the groundwork done first to give them their voice, because sometimes what people see is just the behaviours and the frustrations and those brick walls that are set before them.
It was just such a fantastic show of all the different partners that were involved in this project, all the different collaborators from the therapists, the schools, the health department, everybody involved. It just showcased what working together can do. What really touched me was hearing one of the parents speak of one of the children that was here today. I think that was a really emotional testimony to the impact that the therapies can have on a child who has profound or complex disabilities. I think it really moved everybody, but as well, it was important to see how initiatives like this can ripple out into the wider community as well, and seeing some of the young people and in the videos, especially the little music performance that we all got, just shows that actually putting in place these really important initiatives now for children, whether it's in school, outside of school, it can equip them with skills to be able to come and be able to perform in front of a whole room of people today and to see, the joy on everybody's face, the children included, just shows how important this work is.
So it was our way of re-engaging with those most vulnerable people to ensure that they had a voice in the system and in the transformation that is underway at the minute, because we all know that the system has to change to improve outcomes for all children, and particularly our children with special educational needs, those with the most complex needs.
It was just brilliant to bring all the key partners together, and just for once just to hear the voice of the children and the young people. And I think it was really important to show how you need different mediums to get that voice of the children and young people, and whether it be art or music or drama or play therapy. And I just think it just was a real celebration of hearing that voice. And I just think it bodes well for the future.
Well, the key takeaways are the absolute delight and better outcomes that you get through collaborative working. And I think we saw very clearly through the presentations the impact on children, in the classroom and at home in their day-to-day lives. And that's really what we're aiming for. And so I know that health and education are working together at a very strategic level, but this is allowing schools and all their partners really to create a grassroots approach to what they know works well on the ground.
It is really important and critical that we look at collaboration, we look at integration and connections. They may start small, but we can enhance and build those if they're more system-wide. Again, hearing the stories of the families and the parents is just critical for us. We need to hear that. We need to listen to them, and we need to take account, and children be in the centre of everything that we do.
If I lay here